When it's time for your patient to have their ostomy pouch changed, you want to make sure you go in and wash your hands so you have clean hands to start. You're going to want to then apply your gloves to your hands. You don't want anything getting onto your hands. It's safety for yourself as well as the patient. You're going to want to have the patient lay down. It's easier if they can lay down on a bed, and you're going to have a towel or something underneath of them so that if something does spill over, you're not making a mess and having to change their entire bed. Simply you can either wash or throw away the padding that you have underneath of them. In the event that the patient does not want to lay down, you can also do this in the bathroom, having them sit up to the toilet, or if they could sit on the toilet, depending on where the ostomy is, sometimes you can get them to empty and change an ostomy while they're sitting on the toilet. Ideally, in order to put the square on their abdomen and not have a lot of wrinkles, supine position, laying down flat is ideal. When you're ready to change it, you want to have all of your supplies ready. You're going to go ahead and pull off, like we did for the burping of the bag, pull off the pouch. Okay? Now, sometimes after you've pulled off the pouch, there is still going to be leakage from the ostomy itself. So you're probably going to want to kind of leave the bag up a little bit while you're working on taking the adhesive off. Okay? Just in case it does start to continue to flow, that you have something catching it. You'll want to be very careful of the patient's skin because at times they have very fragile skin. It can tear, gets very irritated. You'll notice that at some time there will be a lot of reddened area under the skin, or I'm sorry, under the patch because of the frequent changes. This will get better over time as the skin toughens up. However, initially it can be very tender for the patient. You want to work around all of the edges. If you're having a difficult time or the patient's skin is very fragile, I would suggest using an adhesive remover wipe. Then you can just kind of wipe around there and it should help pull off the adhesive a little bit easier. Once you get all the way around, you can go ahead and pull up on the wafer itself. And all of this would be thrown into the trash. Okay? This is again another time when you're going to assess the ostomy. You're looking to make sure it's moist, it's bleeding a little bit, that's a good sign. There's no yellow-white discharge around it. There should not be a red, warm area of skin around the ostomy. That would be a sign of infection. A lot of times what you may see, if the hole is not cut appropriately, you'll start to see some irritation on the skin right around the ostomy where fecal matter has sat on the skin and caused a lot of irritation. We're going to be very careful about how we cut those so that that does not happen. But as you're assessing this, you want to make sure there's no darkened areas, black areas, which would indicate dead tissue, that it's moist, it is having some fluids coming out, and that the tissue around it is soft, red, not gushing blood, but you would have, if you've touched it and manipulated a little bit, notice some bloody tissue there.